So as a children's doctor, I was getting increasingly fed up of sending children back to homes that were making them sick. So my research looks at the link between cold, damp homes and chest infections in children. It also looks at that delicate balance between how some ways of making homes warmer also trap in indoor air pollution, which can also make children more unwell. So it's quite complex. It's really broad. It includes child health, it includes inequalities, housing, energy, climate. We are working with a fantastic group of parent partners who have been absolutely integral to making sure we're asking the right questions that will impact their lives. But actually being able to find the right people with the right expertise for this project was challenging, because I think some folk would think of the particular group as being hard to reach, but actually I would counter that in saying that they're quite easy to ignore. So these are people who are not often involved in research studies or in public engagement. So our approach was to go through partners such as Poverty Alliance and then word of mouth, and we had a lot of time working with individual parents because we were exploring very sensitive topics. So they build up their confidence and were happy to share things on a one-to-one basis before then coming together as a group. The ability to actually use their experience and turn it into evidence, I think, has been really powerful. I've learned so much from the families that I've worked with, and I think the number one thing that I have taken away, and I would love other people to use as their approach in PPI, is to always focus on being restorative and not extractive. And I think that if we focus just on paying people for their time and their involvement in public engagement groups, you're really missing a way to actually build the capacity of the people that you're working with. And money is important, but it isn't everything. And I think we need to reflect on other ways to go beyond remuneration to involve our partners, our community partners in research.